Accurate diagnosis of the type of mesothelioma, as well as mesothelioma staging, is necessary in order to create an effective treatment plan for mesothelioma patients. Mesothelioma staging is a process that is used to determine if the mesothelioma cancer has spread outside the pleura or peritoneum, and just how far the disease has spread outside the pleura or peritoneum. Doctors can create the very best treatment plan once the stage of severity of the mesothelioma is determined. There are several staging systems currently being used to determine whether patients are in the early stages of the disease or the advanced stages. The staging systems include the TNM staging system, the Brigham staging system, and the Butchart staging system. The Butchart staging system was created by cardiothoracic surgeon Eric G. Butchart and is the oldest of all staging systems. It is based on the magnitude of the primary tumor mass. While the Butchart staging system has been around since the 1970s, it is still currently being used by many specialists for its advantage of simplicity and relevance to prognosis and therapeutic options. There are 4 mesothelioma stages doctors may assign once Butchart staging is complete. They are Stage 1, the earliest stage of the disease, Stage 2, Stage 3, and Stage 4. Stage 1 mesothelioma using the Butchart system means that the mesothelioma is present within the right pleura or left pleura. It may also involve the lung, pericardium, or the diaphragm, which is the muscle that separates the chest from the abdomen on the same side of the body. Stage 2 mesothelioma using the Butchart system means that the mesothelioma has invaded the chest wall or involves the food passage connecting the throat to the stomach, the esophagus, as well as the heart or pleura on both sides. The lymph nodes in the patient's chest may also be involved. Stage 3 mesothelioma using the Butchart system means mesothelioma has now penetrated through the diaphragm into the lining of the abdominal cavity or peritoneum. At this point, some lymph nodes beyond those found in the chest may also be involved. Stage 4 mesothelioma using the Butchart system means there is strong evidence to support that cancerous cells have spread to other organs of the body via the bloodstream, called distant metastasis. During the staging process, several tests and procedures may be used, including chest X-ray, CT scan or CAT scan, magnetic resonance imaging, and endoscopic ultrasound. Chest X-ray involves an X-ray of all the bones and organs inside the chest. A CAT scan is a procedure that takes pictures from different angles of the abdomen and chest. Also called computed tomography, computerized tomography, or computerized axial tomography, CAT scan images are created by a computer linked to an X-ray machine, and in some cases, a dye may be swallowed or injected, making tissues and organs easier to see. Magnetic resonance imaging, or MRI, or nuclear magnetic resonance imaging, uses a magnet, radio waves, and a computer to create detailed pictures of the abdomen or chest. Endoscopic ultrasound is also called endosonography. It is a procedure that involves the insertion of an endoscope, which is a thin, tube-like instrument with a light and a lens for viewing. This goes into the body. A probe at the end of the endoscope bounces high-energy sound waves off internal tissues or organs. This creates echoes, which form a picture of body tissues. The picture of body tissues is called a sonogram. Endoscopic ultrasound may be used to help guide fine needle aspiration biopsy of the lymph nodes and lung, as well as other areas of the body. Once the stage, type of mesothelioma, and overall health of the patient have been determined, the doctor will explore the various treatment methods. The treatments and methods used for treating mesothelioma can be divided into 2 groups: traditional mesothelioma treatments and new mesothelioma treatments. Traditional mesothelioma treatments include surgery, pleurectomy decortication or PD, extrapleural pneumonectomy, pleurodesis, peritonectomy, chemotherapy, anti-cancer drugs which are usually injected into a vein, and radiation therapy or radiotherapy. Radiation therapy or radiotherapy involves the use of high-energy rays to shrink tumors and kill cancer cells, but it only affects the cancer cells in the treated area only. There are two types of radiotherapy, including external radiation therapy and internal radiation therapy. External radiation is generated through a machine, and internal radiation therapy is delivered directly to the source of the cancer by placing radioactive materials into the body through small tubes. In many cases, a trimodality approach is employed, which means several treatments are combined for the best outcomes, for a better chance at long-term survival, and/or a better quality of life. New mesothelioma treatments include gene therapy, photodynamic therapy or PDT, immunotherapy, intensity modulated radiation therapy or IMRT, and the development of new chemotherapy agents. In addition to these new mesothelioma treatments, there are several other radical treatments available, including angiogenesis therapies, anti-neoplastin therapy, mesothelioma clinical trials, interferon and interleukin therapy, and radiofrequency ablation. A wide variety of complementary and alternative mesothelioma treatments also exist, such as herbal products, special diets, homeopathic medicine, acupuncture, therapeutic massage, high-dose vitamin C, Laetrile, and Eastern medicines. Following is a brief description of the other two mesothelioma staging systems. The TNM staging system is considered to be the major staging system. T stands for tumor and refers to the tumor size and how far it has spread to nearby organs. N stands for spread to lymph nodes, and M stands for metastasis, whether the mesothelioma has spread to other organs. The TNM staging system assigns categories and numbers to determine the overall mesothelioma stage. The Brigham staging system also uses 4 stages, and it is based on whether the mesothelioma can be treated or removed by surgery. It is also based on whether or not the body's lymph nodes are involved.
Thank you for watching. This video was produced by Asbestos.Net, a leading resource on all aspects of asbestos and mesothelioma. Our priority is to inform victims about the devastating effects of asbestos exposure, mesothelioma, asbestos cancer, asbestosis, and other asbestos-related diseases, and to advise them with a wealth of information. Individuals whose lives have been touched by mesothelioma have numerous questions and concerns. Their caregivers and family members also need accurate, reliable information. If you or a loved one have been diagnosed with mesothelioma or asbestos cancer and need more information, we invite you to visit and explore the thousands of pages of oncologist-reviewed material on Asbestos.net, to call our convenient toll-free number shown below and speak with a mesothelioma specialist, or to use the simple contact form found at Asbestos.net to request a free copy of our informative books, custom inserts, and DVD. Asbestos.net. Information and help for patients and families.